Back extensions won't fix your lower back pain. I know there are a lot of people online and other professionals who work with people face to face. They will suggest back extensions as an exercise to overcome lower back pain. What we're going to do is not only talk about exercise in a wider perspective for lower back pain, but we're also going to narrow in on the back extension, compare it to the bird dog, and see some of the key differences between these exercises and why back extensions is a less effective exercise to be using. To start with, we're going to look at the back extension. We're going to flip between the back extension and the bird dog. So the muscles that are involved in the back extension is longissimus and iliocostalis, which you can see here and here. So they're muscles that basically go up the length of the spine. There are different sections to it, but they're the muscles that we're essentially talking about. When we've got the back extension exercise, what we're also talking about is compression on the spine. So the muscles are activating. They are muscles that you want to activate, but depending on your pain trigger, there are compression around the spine of 4,000 newtons up to 6,000 newtons. And what compression is, if you look at this diagram here, so let's just say the spine is the sponge, and then you've got the fist going around it. The compression is the squeezing of the sponge, because you've got not only on the right side of the spine, but you've also got these muscles on the left side of the spine. So what's happening is you've got these muscles here and here essentially compressing around the spine. So if you've got a pain trigger that is compression, then again, this isn't an effective exercise. If we look at the wider scope of things, if you are pain-free, then it could be seen as a useful exercise for activating the muscles. But what we're going to explain in future slides is, again, why it's less effective. Then when we compare it to the bird dog, which is this exercise here, so I'm on my knee and hand there, and then I've got my opposite arm and leg in the air with shoulders nice and level. Muscles that we're talking about, longissimus, iliocostalis, so the two that we've looked at already, so here and here, obviously on both sides. But what we've also got is latissimus dorsi, which comes down the back, and then glute medius, glute minimus, and even glute maximus, which again are sort of wrapped around on the pelvis here. So there's more muscles involved, which is, again, it's a key component of not only back pain rehabilitation, but also for back health and spine health in general. So we want more muscles working more of the time. What we also get with the bird dog is, well, we could put here 2,000 to 3,000 newtons of compression. So there's still the same mechanism, but what's happening here, because we've only got, let's just say, one side working at any one time, we can essentially cut that compression in half. So for a back pained person, it's much more effective because the compression is less, but we still get the muscle activation. So again, as I've mentioned, there are better options out there. They're still, in some respects, doing the same thing in that they're activating the muscle, but they're doing half at a time. They're getting more muscles involved, so we're getting less of the compression and we're getting more co-contraction. So we're getting the benefit with less of the drawback, if you will. So again, you can see how the bird dog then becomes a more effective exercise. What we're going to do now is we're going to flip back to the back extension and talk about the actual mechanism of extending the spine. The back extension movement involves a hyperextension of the spine. So if you're laid on the floor, so these are the legs here, there's the pelvis, that will be the head. There is some sort of extension and the chest is coming up off the floor. Now, when the spine is forced backwards into an exaggerated arch, this forces the facet joints. Now, the facet joints are these joints, so these are the bony bits. So if you put your hand on your back and you've got the little knobbly bits as you go up your spine, that's these spinous processes. Then between each vertebra, you've got these little joints which go here and here. So that's opened and this is closed. So this is flexing forward and this is extending back. And then what's happening is these joints are getting forced together, again, causing some degree of compression in the joint, which is going to be causing a problem. So this forces the facet joints to override with bruising of the nerve, stretching and laxity of the joints, and may result in subsequent abnormal micro movements at this segment level or a disc rupture. So we can start to see that we could get problems at the facet joint level. We can get problems at the segment level, which is essentially, this is a segment here. That's a segment, because there could be a little micro movement. A micro movement can create a spasm because of the stretching and the laxity that's there, that's caused by the overarching of the spine. So what we need to start understanding is the injury mechanisms of the spine, and that starts to point us in the direction of less effective exercises and more effective exercises. Because again, if we compare that to the bird dog, the spine stays in its natural curve. So we've got the thoracic, we've got the lumbar, and then we've got the hips here with the leg out here and the arm out here. So this basically from here to here shouldn't move. So again, if we look at the actual movement of the spine in the back extension, you can start to see again, it's not an effective way of training the spine. Again, if you've got a healthy spine, okay, maybe there's an option for using it. But even that movement is the mechanism for injury. So why would you do that to the spine when you don't need to, in order to keep it strong? And when we go back to the bird dog, we'll talk about that. Next for the back extension, and it's a little bit more extreme, and I'm not saying that this is going to happen just because you're doing back extensions, because there are other factors that will affect and contribute to it. What I'm trying to say is that the mechanism that's happening within a back extension is essentially can result or can contribute towards these types of injuries. Obviously, these are at the extreme end, but there are other things on that sort of scale that can cause problems before it gets to that point, i.e. the stretching and the laxity, which can lead to the micro movements, which again can lead to back spasms. So we've got spondylolysis, and then you've got pars defect here. So a pars defect or spondylolysis is a stress fracture of the bone of the lower spine. These fractures typically occur due to overuse. So we're talking about overuse. So we could even involve lumbar flexion, we've got lumbar extension, lumbar twisting, so on and so forth. So pars defect are caused by an overuse of the lower back, mainly from sports that involve repetitive back bend-like motions. So again, that back extension type mechanism isn't an effective way of doing it. We're much more effective and stronger in that sort of neutral posture. And again, whenever I say neutral, it gets people going because you think you got to stay stationary. That doesn't mean staying stationary. When we're talking about loading the spine, it's different from just everyday movement, if that makes sense. So, and the examples is gymnastics. And again, like on the last slide, I've got the source for that. But what we're talking about, you've got the stress fracture here, and then you've got the pars defect in here, because it's the pars interarticularis, which is between, again, the vertebra. So you can start to see, as you start exploring the injury mechanisms of the spine, you can start to look at exercises and go, well, that doesn't seem the most effective thing to be doing if what could be a result of a lot of back bending is this injury or this effect, if you will. And as a continuation of that, gymnasts routinely place large forces of hyperextension, hyperflexion, compression and lateral rotation on their spines, performing such manoeuvres as front and back walkovers, flips, vaults and dismounts. Now again, this is at the extreme end, but another thing we have to understand about back injuries is or for the majority of them, it's the straw that broke the camel's back. So a lot of people are told it's non-specific, or a lot of people are told it's just a random event or it's wear and tear, but all of those are the result of the straw that broke the camel's back. So we need to start treating our spines in a more healthy way. If we can treat it in a more healthy way, we can slow all of that progression down. And one of them is by voluntarily going into a gym and doing these back extensions, back flexions. As you can see here, it's extension, it's flexion, it's compression, it's lateral rotation. So all these different maneuvers of the spine, again, under load is only going to make the problem, in some respects, that little bit worse. So we need to start treating our spines a little bit more healthy by using exercises like the bird dog, which we're going to talk about next. If we delve a little bit deeper into the anatomy of the muscles, again, it starts to paint a different picture. Because we've taken the reductionist point of view, or maybe an influence from bodybuilding in muscle contraction and muscle activation, because they've broken down all the muscles, we need to isolate off muscles and make them active and make them stronger. If we take that perspective, then back extensions seem to make sense. But as we delve a little bit deeper into the function of the core and the function of the core muscles, we can start to understand there's a little bit more of a nuance, and we can understand a little bit more context about what we're trying to achieve here. So research shows that the aforementioned muscles, iliocostalis, the longissimus, that attach to the thoracic region are actually the most efficient lumbar extensors because they have the longest moment arm. Now what that basically means is, obviously we've got the pivot point here, long moment arm, that is the moment arm. So we've got let's just say the pivot point here, and then we've got the long moment arm here. So if we can activate up here, it's much more effective at managing what's happening down here because of the long moment arm. So it takes less work to do the same job. If we're trying to turn this moment arm here, it takes a lot more work to do it because it's much shorter. So if we can activate these muscles through here, again, on both sides using the bird dog, we minimize the compression, but we also get the holding of position, because all of this down here is very tendinous, known as the thoracolumbar fascia. So when these muscles activate, it actually holds this part of the spine most effectively. So we can get the most out of these muscles. So it's much more effective to use the bird dog-like exercises, getting the arm up, getting the leg out, and effectively using those long levers to activate further along these muscles. And then obviously with the leg up, we get the effect of the glute below it, glute max, glute medius, so on and so forth. So we're not only using the thoracic region to stabilize the lumbar, we're also using the pelvic region to stabilize the lumbar. So we're using these slightly longer moment arms to stabilize the lumbar area, and we're doing it in a way, because we're going from side to side like in the bird dog, it's much more effective for the very simple reason that we're reducing the compression on the spine. So if we have got an unhealthy spine, we're not putting as much stress on it. And this is sort of continues what I've just been talking about. So training lumbar extension mechanism must involve the extension at the that attach the thoracic vertebra. So we're much more effective in being in the bird dog, lifting an arm up, because that then activates this lumbar region. Once we can activate that lumbar region, again, we're using this long moment arm, as I've mentioned, whose bulk of contractile fibers lie in the thoracic region. So we're much more effective at keeping the thoracic spine extended, which will then stabilize here, rather than trying to extend the lumbar spine, which is trying to, again, use the moment arm down here, which is a short moment arm, which is an inefficient way of training. So if we use the contractile fibers up here, like in the bird dog, it's much more effective. The tendons pass over the lumbar region because they have the greatest mechanical advantage, which is essentially what I've just described. So again, we're using these muscles up here, these muscles down here, to stabilize the lumbar area using a longer moment arm. And finally, we get to the end. Thus, exercises to isolate lumbar muscles cannot be justified anatomically or from a motor control perspective. So from an anatomic reductionist type perspective, it's not justified. From a motor control or movement perspective, is not justified, because all the players in the orchestra must be challenged, i.e. you've got thoracic extensors, you've got hip extensors, you've got hip stabilizers that all need to be playing their part to stabilize what's in between. If we're just using lumbar extension, again, this machine here, which is touted as one of the best machines in the world for lower back pain, again, it's using this lumbar muscles, which is ineffective. We want to be accessing thoracic muscles and hip muscles, which is a much more effective way of doing things. So if you do need some help with lower back pain, you do want a little bit more advice that fits with the science a little bit more, just click the link below, go through to my online consultation and coaching page, enter your details, get started, and we can get you booked in as soon as possible. So many thanks for watching. My name is Chris. I'll speak to you in the next tutorial.